Afternoon, everybody. I think we've waited as long as we can for others to join the call. So today's webinar, just 30 minutes, very broad overview of the GDPR and cybersecurity in health and social care. Because it's only 30 minutes, we won't have time to deal with questions live. So please email any questions or comments to hello@pulsecyber.co.uk and I'll answer them within the day. So I'll get to them as soon as I can. It's a big subject and we've only got 30 minutes, so it'll be a very broad overview, but hopefully we'll cover some really specific content that will be of interest to you all. Just a quick introduction. My name is Richard Jackson. I'm the Senior Information Security Consultant with Pulse Cybersecurity. My background is quite varied, which is quite unusual in respect of the fact that I have a GDPR angle, as well as being focused on cybersecurity and a background in project management and business analysis with organizations. So it gives me a bit of a kind of leaning towards helping businesses to manage data security while understanding that you have a business to run and it's not always the main priority. How does Pulse Cybersecurity work with health and social care? It's one of our primary sectors. We focus a lot on the NHS Data Security and Protection Toolkit, the DSPT, and we complete them on behalf of our clients and with them to unlock NHS Mail, which I'll talk about a bit further into the presentation. We write GDPR policies and procedures. We deliver training and awareness sessions and workshops, either remotely or on site. We offer a data protection officer as a service, and I'll focus today on DPOs and why they're important in this sector in particular, and a whole host of other offerings, even down to web design for healthcare organisations who may need to refresh their brand if that's required. So a few headlines just to get us started in health and social care. Virtue published a report quite recently about their 5 biggest challenges for the sector. These will be quite common themes to you, I'm sure, in respect of health information collection, exchanges and electronic health records, user error and technology adoption, hackers and the rise of hacktivism in this sector, the adoption of cloud and mobile technology, which if you're using care apps, for those of you that are domiciliary care providers, this will resonate with you. And also what I find quite commonly is a use of outdated technology, either on site or remotely. What is digital health? It's a big question at the moment. Definition on screen from Frost and Sullivan is quite interesting. So it talks about the application of data to the delivery of healthcare using computational and telecoms technologies to support business process workflow, clinical workflow, and patient data management. And I think patient data management is the one that probably rings true mostly for why you might invest in health tech. The issue with health tech at the moment is that it's shifting the whole industry globally quite powerfully at the moment. It's an industry which is worth nearly $200 billion by 2023, so it's huge. There's a lot of pressure on you to invest in health tech, but not always a focus on security of that data, which is key. So Pulse Cybersecurity will help you with that in terms of procuring the right kind of health tech for your organization, but making sure that the focus is on security, not just on process and making your lives easier. The adoption of digital health is inevitable. So regardless of where you are as an organization and your own technology standards, the type of tech that you're using, you will find that you will be inevitably pushed towards using it. A good quote from Stephanie Domas while talking at TEDx in Columbus a few years ago about why health data and electronic health data in particular is so valuable, especially on the black market. So in terms of ID records, almost 70% that are stolen or breached are from health and social care, which is an extremely high number. In comparison between your stolen credit card data and health data, there's a huge difference in terms of what it's worth on the street, as you can see from the numbers on the screen. There are very specific reasons for that. If you consider the illegal use of your credit card can be rectified very quickly, it can be stopped and the loss of money reimbursed with very little harm done other than some inconvenience. If you then weigh that against the impact of maybe your electronic health data going missing or getting breached or stolen, you're looking at things which are irreversible because they're factors about you as an individual which won't change. So if you think about national insurance numbers, potentially your home address would change, but it's not immediate. Medical history obviously is something which is permanent. Those kinds of things can be used to create identity fraud, false personas, and that can be long lasting. It's extremely valuable to cyber criminals, and that's why they target the health and social care sector as they do. And if we then take that a step further and we look at the top 5 industries for data breaches, last year, health and social care is standing out on its own. So even though business, in inverted commas, is accounting for 36% of data breaches, that's private sector organisations of all kinds. Health and social care on its own is accounting for only half of all data breaches globally at the moment. So that, when you compare it to the value of the data, that links really closely to that, and it explains why those breaches are maybe so high in health and social care. The other thing which is going on in the UK, and I will talk about the UK today, apologies to our attendees from the United States and from mainland Europe. I know we've got some of you on today's webinar, and welcome. We will focus on the ICO, the Information Commissioner's Office in the UK, and also the National Health Service, the NHS, but hopefully it will still be of interest to you and will resonate with regards to your own supervising authorities or health providers. In the UK, what we're starting to see is not only fines and punishments for data breaches by employers, but we're also looking at prosecutions of individuals. So we've got 3 case studies. We've got a former administrator of an NHS trust who was prosecuted for accessing medical records without authorization. And based on an investigation, this person was appearing in front of Birmingham Magistrates Court, admitting offences, lost a job, probably won't work in the sector again. The fine was £1,000, but it's almost irrelevant in the context of the longer lasting damage to the reputation of that person. We also have, which is really interesting, a GP practice manager who was fined for sending personal data to her own email account, which is something that people probably do or have done in the past on quite a regular basis without maybe any consideration for why that might not be a good idea. This resulting in a prosecution, suspension for unrelated matters, and also dismissal, as well as the fines, although not quite as high as in the previous case study. And the final case study of a Mr. Z in Manchester, a former social worker, who was revealing and sharing quite serious information about vulnerable young people who had been in foster care. Again, lost their job, were fined. And in respect of prosecutions by the Information Commissioner's Office of individuals, health and social care is accounting for around 25% in the UK. So again, another high damning statistic focusing on health and social care. I'm going to give a quick overview of the GDPR. We've only got 30 minutes. That wouldn't be long enough on its own. So we're going to give a very quick overview of the General Data Protection Regulations for those who just need a bit of a refresh. First of all, my own personal view, and potentially the view of Pulse Cybersecurity as an organisation. We don't believe there's such a thing as actual GDPR compliance, because it's a very fluid state. It's you could be compliant in the moment, then within the next few minutes, one of your employees does something or carries out an accidental act which causes a data breach. You're not compliant in that moment. So it's an ever-moving target. It's fluid, and it's something to aspire to be at all times. But there is no such thing in our view as compliance as such. What is the GDPR? It's a regulation that was 7 years in the making, very much supported by the EU in terms of getting it into law, which was the case for the states involved in 2018, around May the 25th in the UK. And it was aimed at strengthening the rights and freedoms of individuals and placing the obligation on the organisation to process that data, to be more careful with how they manage it, essentially. It's a big document. It's well worth getting into in more depth. Obviously, we're very much skating over it today. It gives individual data subjects 8 key rights about how their data should be managed, and it's in the interest of individuals to take it upon themselves to become more educated in respect of the GDPR, because it would still be surprising to most individuals how many rights they've got and how they can exercise them relatively easily. There's also 6 principles within the GDPR in the way that organisations must process data in respect of the lawfulness. You need a lawful basis for processing personal data, of which there are 6. You need to only process it for the purpose that you hold it. It needs to be accurate. We talk about data minimization, which is essentially you should only have the data you really need, and storage limitation and integrity and confidentiality. So again, we're going through at quite a pace. Be more than happy to share these slides with anyone after the webinar today. Key factor really in terms of education of your employees and of your senior management teams is understanding what personal data is. And there are two types of personal data. Primarily, personal data is any information about a living individual. Common personal data that's involved in breaches would be things like first name, surname, home address, email address, an identification number, IP address or location data. But the key for health and social care is sensitive or special category personal data, because health data is a special category, and as such it places more of an emphasis on you to process it more securely and to have better technical controls in place and to have a well-informed, well-advised workforce that understand the GDPR, that understand cybersecurity, information security and data security, and know how to, for instance, acknowledge and recognize a breach when it occurs and how to act on it. So your processes, your policies, your procedures, your training, your culture within the organization in health and social care should be very much focused on the protection of data and data security. Interesting factor, and I presented this to a large group of accountants in the UK and Ireland last week in respect of how is Europe as a whole issuing fines in respect of the GDPR, because there's some apathy in Ireland and in the UK about the level of fines so far. There's only been one, which I'll come to in a moment, and I'll talk about in more depth. Whereas in other countries, in other nation states, we're seeing really high, consistent fining, particularly in Spain, with 80 fines so far. My take on that is that they've evolved a culture very quickly where they see the fining for data breaches, regardless of the seriousness and the depth or scale, to be really important in terms of educating data processors, data controllers, in terms of looking after that data properly. So the fine essentially is seen as a means to raising awareness. Germany, Romania, Hungary and Bulgaria, equally around that kind of 20-25 fines mark so far. But if we look at the trend, and this is the key factor to focus on today, there's been almost 500 million euros of fines so far in the 22 months or 23 months now since the GDPR came into law. But the high majority, 64%, are in the last 6 months. So that suggests, as you can see from the graphic in the corner, that the nation states and the supervising authorities in each country are gradually starting to fine more often. Irrelevant of the amount of money involved, the fines themselves are starting to become more common. And had it been maybe not for COVID-19 in the early part of this year, we might be already seeing the UK and Ireland issuing more fines. I think at the moment it would be a bit of a PR disaster for organisations to be fined for data privacy issues, as well as dealing with actually keeping their businesses alive in respect of COVID-19, home working, furloughing staff, etc. But I don't think this is going to go away. And I think instead of maybe the first part of this year, we're going to start to see this trend reoccurring in the autumn and early into 2021. So I think this is something to watch out for. In terms of the challenges for health and social care in the UK, we also have organisations like the NHS and the Care Quality Commission very much focused on data security. It's, for instance, with the CQC, it's now a big part of what they're looking for as standard when they come to visit you. They're acknowledging and recognising the importance of data security. So they're enforcing their own standards upon you, as is the NHS with the Data Security and Protection Toolkit, which we've mentioned already, but we'll mention in more depth soon. And what I tend to see in the health and social care sector is a mistaken focus on the NHS, CQC or local authorities as the enforcers of data security standards, and maybe a lack of awareness of the ICO or even who the ICO is, and the fact that the ICO has the power to end your business, essentially, through high fining or the reputation damage that goes with your data breach being published in the public domain. Data breaches, the reality, unfortunately I've lived through a data breach, wasn't a pleasant experience. What is it? It's the intentional or unintentional release of secure or private confidential information to an untrusted environment. In short, personal data going somewhere it shouldn't go. Examples of a data breach, some of these will be recognizable to you, such as loss or theft of hard copy notes, USB drives, computers and mobile devices. An unauthorized person, maybe a family member, getting access to a laptop, email account or network, sending an email with personal data to the wrong person. Very common, that's probably the most common, as well as a bulk email that goes to individuals and lists all those email addresses instead of blind copying, which is, again, very common. Not so common, but equally damaging, is disgruntled employees, maybe carrying out a malicious act or a break-in in the office, for instance. So physical security plays a big part in data security as well. And if we look at the leading causes of data loss or data breaches, you can see that employee error and loss of stolen devices combined account for 60%. So they're human issues. So, and if you also look at criminal attack where people are maybe submitting themselves to phishing attacks and clicking where they shouldn't, you can easily see and very quickly see the large percentage of data loss. And the issues within cybersecurity are very much focused around human beings, human error, your employees who represent your greatest risk. And the true cost of data breaches is quite significant. Now that the GDPR has been enforced for a couple of years, statistics are very commonly available, very freely available. 32% of UK businesses reported a breach last year. The average cost was just over £4,000, but that doesn't include fines. That's just the activity and the actions you take in order to manage the breach, to mitigate or to engage with those people affected. The reputational damage is far worse because people won't trust you with their data anymore, and you do find that there's a breakdown in team culture and a build-up of resentment if an individual or a small team within your organisation has been responsible for that breach. 33% of organisations say they've lost customers after their data breach. That was my experience. And a study of UK and US companies found that 38% had lost business generally due to security issues, and that 44% of UK consumers will stop spending with the business after it's been breached, as it no longer can be trusted with their personal data. And 41% claim they'll never go back to a business post-breach. And the scariest maybe statistic on here of all is that 60% of small to medium businesses will actually fold and go out of business within 6 months of that data breach. Human error is the main culprit for data breaches, and the top 5 mistakes within human error: phishing, which is commonly occurring, extremely common at the moment in relation to COVID-19, which I'll talk about in more depth further on into the webinar. Or letting unauthorized users, again, family members, use your device. Poor password practice, and we'll be running a password-focused webinar in the next few weeks. Poorly managed admin accounts or misdelivery. And again, that's an example of personal data going somewhere that it really shouldn't go and into an untrusted environment. So talking about phishing and cyber attack and the issues in relation to COVID-19, the talk I gave to the accountants last week was very much focused on this subject, very specific. And we can see that Google was declaring on April the 17th, so very recently, only 2 weeks ago, that it saw 18 million daily COVID-19 scam emails in that single week, which is an astonishing statistic, including malware and phishing emails intended to defraud users. Now, what we're also seeing, which Google won't be picking up, is smishing, which is basically SMS or text-related phishing. So texts are coming into your phone, they look trustworthy, and also there's a belief that because we no longer get as many texts as we used to, because we use Messenger or we email more, that people are more trusting of text these days and are more likely to click on a text attack than they are email, which is really interesting. Google was also reporting a further 240 million COVID-related daily spam messages, but was confident that its algorithms are screening out 99.9% of fraudulent emails. However, the intent is quite staggering, and the volume is quite staggering, and also the volume and speed of how quickly these domains were set up in February and March was really interesting. And the COVID-19 Cyber Threat Coalition, working together again around the similar time in mid-April, they picked up that criminal groups and nation-state actors, interestingly enough, are exploiting COVID-19 to target healthcare systems and critical IT infrastructure all over the world. Hundreds of thousands of fake domains, so that's email and websites, were set up mid-Feb to mid-March, and approximately 5,000 domains were being registered daily, which is incredible. And that was including fake websites, fake email domains for the World Health Organization. If you receive an email from WHO, you'd imagine it would be genuine. People are getting caught out that way, and these are the kind of lures that are coming into your inbox. And if you run a healthcare organization, maybe particularly residential care or domiciliary, and you're receiving emails offering you PPE, COVID-19 test kits, vaccinations, cures, fact sheets, etc., or even if you're an individual and you've had an alert from a text and SMS that you come into contact with someone with COVID-19, you would potentially feel obliged to act on that and a little bit concerned and worried. And I've seen examples of this in the last 24 hours on LinkedIn, where colleagues on LinkedIn are showing SMS screenshots of what they've received, and it's exactly that, declaring they've come into contact and that they should act upon it. A little bit of information about the ICO. Apologies at this point again for going through the webinar at pace. We've only got half an hour, and today is designed to give a broad overview. The ICO is the UK's independent body to oversee the GDPR and uphold information security rights. It oversaw the rollout of the GDPR and is responsible for issuing fines and investigations. Slow so far, as we've said before, to issue penalties, but a key one, and this is the only fine in the UK so far, is for Doorstep Dispensary, which is a pharmacy based in London, £275,000, originally £400,000, but reduced, for failing to ensure the security of special category data. So this is an organisation in the health and social care sector fined an extremely large amount of money for mismanaging patient data, and this was actually in hard copy, paper records, stored in unlocked cabinets within a locked courtyard. So the environment was locked, but the cabinets were unlocked, and also there was an extreme lack of accountability in terms of missing policies and procedures. There are very few policies and procedures in relation to the GDPR and data security. So they were fined on the 17th of December. They were given a month to pay in full. They did appeal subsequently, but lost that appeal. So we're doing some research at the moment to find out exactly what's happened to Doorstep Dispensary and whether they are still trading. What does it mean? Well, it means that a statement of intent really from the ICO. And if you look at the fact that it happened in December, just before COVID-19 started to come to prominence across the world, I do think this was the intended start of significant fines in the UK, and maybe they've taken their foot off the gas temporarily. I think that, again, like I said, this will be the autumn focus and maybe into early 2021. The interesting point here as well is what the ICO weren't the original investigators on site. It was the MHRA, Medicines Healthcare Products Regulation Agency, investigating Doorstep Dispensary for a potential sale of unlicensed pharmaceuticals, which tells me that third-party agencies are going to be liaising quite closely with the ICO and whistleblowing, for example, CQC, HMRC, the NHS, organisations that will be on site or potentially aware of your working environment. If they see insecure processing of data, I'm pretty confident they're going to flag it out to the ICO. So that's something to be aware of. The NHS in particular is very, very focused on data security. If you process data on behalf of the NHS, you will be asked to complete the DSPT, the Data Security and Protection Toolkit, especially in order to access NHS mail. Now, at the moment, because of COVID-19, the NHS has temporarily granted access to NHS mail, even for organisations that haven't completed their toolkit. This will be revoked later in the year. It's a temporary measure to ease the burden and to increase the collaboration and awareness and communication standards between private sector organisations and the NHS. But you will have to go back and complete that in due course. Why does the NHS care so much about your data security? Well, if we go back to the GDPR, one of the factors within the GDPR is the fact that you have data controllers and data processors, which again is a subject all on its own and well worthy of a webinar, just to focus on it in more depth. In this instance, the NHS is the data controller and you as the healthcare provider are the data processor, but also there are third-party processors which you may engage, such as a healthcare management app, as an example. But in reality, if there's a data breach, the data controller is the organisation that receives the fine and the punishment from the ICO. So the NHS wants to protect themselves from that. However, if you process the data or your sub-processor processes the data in a way that you shouldn't, the NHS could claim some of those damages back from you. So that's something to be well aware of. Make sure you've got data processing agreements with anyone that processes data on your behalf. NHS Mail, a little bit more detail about that. It's a secure email service provided by Department of Health and Social Care. And it really is their secure method of email. They only want to grant it when you've completed the DSPT, as I've said, but they've temporarily reduced those standards. It is very temporary. September, most likely, we'll start to see this ramping up again, and Pulse will very happily support you with completing your DSPT, either at entry or full standard. Today, I put this slide in at the last minute, actually. So this is a landmark decision in relation to data protection officers. So yesterday, the Belgian DPA fined Proximus, which is the largest of Belgium's 3 mobile telecommunications providers, €50,000 for appointing a data protection officer that essentially represented a conflict of interest. So you should only appoint a data protection officer if they have the expertise and the experience to carry out the role and the qualifications, but also that they're independent of decision making within the organization in respect of, if there is a data breach, they'll do the right thing in respect of the data subject and the ICO, and not necessarily make a biased decision on behalf of protecting the organization that suffered the breach. So it's very clear in the GDPR about how that works. Essentially what they're highlighting here is that the DPO wasn't involved enough in discussion of personal data breaches, and that the company didn't have a policy to prevent any of those conflicts of interest. So do you need a DPO is the key question. Well, if you're in health and social care, it's a really good idea that you do have a data protection officer, because you process large amounts of sensitive data, and it's in relation to health and social care, health-related data, special category. And your DPO adds value because they assist you to monitor that compliance. They inform and advise on data protection obligations, they advise you, and they act as a contact point. So, but choosing your data protection officer can be really, really challenging as well. So who would you appoint within your organization? So they must be independent, they must be an expert, they must be adequately resourced, and they must report to the highest management level, board level. It should be a board level item. They can be an existing employee, but recommended is to actually go outside and get an independent person. Pulse can be your data protection officer. We offer it as a package. Some organizations might choose to share a DPO if they don't have the resource to afford one themselves. But a DPO can demonstrate that compliance, and they're worth the weight in gold if you have a data breach, for instance. So we've raced through at pace a little bit, and I apologize for that. How can Pulse help you? So Pulse can help you complete your data security and protection toolkit. We can create all of your GDPR policies and procedures, and we recommend that in the region of 25 to 35 is about right, depending on the nature of your organization. We can certify you to Cyber Essentials. We'd be very happy to do that, which displays a level of trust that your customers and supply chain can have in you to process personal data. We can be your DPO, as well, I've just talked about. And we can also come in and give you, your team, GDPR, cybersecurity training, either through video conference or on site. And finally, I'd just like to invite you to some of our May webinars. So we're focusing very much this month on the human aspect of data security with 3 key webinars. One, we're going to talk about empowering the human firewall. A few days later, we're going to focus on social engineering and the triggers and what makes people trigger, and how can they be socially engineered so very easily, and how can we stop it. And then a really fun one on May the 18th, where it's a very serious topic: trust nobody, how to beat the cyber criminals. Cyber criminals rely on human trust in order to do damage. So if you're interested in any of those, we'd be absolutely delighted to see you on those webinars. They'll be much slower paced, and they'll be between myself in conversation with Mike Clark of Empowered People Thrive, and we'll be talking about how people tick and how we can educate and reduce this cybersecurity risk. So please go to the Pulse website, www.pulsecyber.co.uk, go to the events page, and you'll find details there about how to register. And if you've got any questions or comments on the back of today's very, very fast-paced webinar, and I apologise, please email hello@pulsecyber.co.uk, or maybe give me a call on my mobile 07368 443 343, or just follow us on Twitter. It'll be fantastic. Find me on LinkedIn, or just have a generally good look on the website and discover how Pulse can work with your organisation and support you in the UK, Ireland, or even overseas. We're here to help. Many thanks for your time today. Speak soon.